Hey guys, Nurse Mike here, and welcome to SimpleNursing.com. Before we get today's lecture started, please remember, check out our brand new app and get access to our new Pharmacology and MedSurg Mastery courses. Plus 11 other courses like Fundamentals, Pediatrics, Maternity, Mental Health, and more. Complete with over 300 follow-along cheat sheets and a massive quiz bank loaded with detailed rationales to test your knowledge. Join for free. Click the link in our description below. All right, guys, let's begin. Now for the 6 top test tips for antibiotics. Guys, write these down. Number 1, we always finish the med to prevent the superinfection. We want to prevent creating any superbugs like C. diff or MRSA. So guys, the key words, take until all the med is finished, and do not stop taking when feeling better. Guys, always educate the patient to finish these meds. Number 2 is accidental pregnancy for Cillins and cyclings. So guys, remember the 3 C's. Childcare for Cillins, like penicillin, and cycling, like doxycycline. Keywords here for the NCLEX is oral contraceptives are ineffective. So we, keyword, use additional contraception, like an IUD. Now, test tip number 3, no alcohol. Guys, antibiotics are hard on the liver, and so is alcohol. Now, test tip number 4, no food for MTF. So just think, move the food. M for macrolides, like azithromycin, T for tetracycline, like doxycycline, and F for fluoroquinolones, like levofloxacin. Keywords here, take on an empty stomach with a full glass of water. Now, number 5 is no sun, so avoid fun in the sun. So remember, FTS. F for fluoroquinolones, like levofloxacin. T for tetracycline, like doxycycline. And a big one here is S for sulfa drugs. Just think S for sunburns. A big drug here is trimethoprim sulfamethoxazole. Fancy words for the brand name Bactrim. And other sulfa drugs are sulfonylureas like glyburide, the oral antidiabetic, and even diuretics like thiazides and loops. These have sulfa derivatives. So some key words on the exam. Their photosensitivity, which means they're sensitive to light. We always avoid direct sun exposure. And guys, a huge risk for sunburn. So wear sunblock and avoid the sun. Now, lastly, number 6, super toxic to the kidneys and ears are the ones ending in myosin, like vancomycin, gentamicin, and neomycin. Guys, just think it's a sin to give a myosin since they're super toxic. So cover your ears and your kidneys. So with myosin, the key points here, guys, write these down. Peaks and troughs. If they're too high, then the kidneys will die. And guys, if the trough's too low, then the infection will grow. So we always report signs and symptoms of toxicity. First things first, ear damage, aka ototoxicity. Keywords for the NCLEX is vertigo or loss of balance, tinnitus or ringing in the ears, and for kidney damage is nephrotoxicity. Guys, we report immediately increasing BUN and creatinine, those 2 kidney labs. So creatinine over 1.3 just means bad kidney. And guys, BUN over 20. These numbers should not be increasing. Now lastly, urine output 30 mLs per hour or less usually means kidneys are in distress. Now a little side note here, don't let the NCLEX trick you. Guys, myosin are the most toxic antibiotics. Not thromycin like azithromycin, and not floxacin like ciprofloxacin. Guys, yes, they end in sin too, but are not myosin. So remember, myosins are the most harmful here. Now for broad spectrum antibiotics are Cillins and sporins. Guys, the mechanism of action is that it weakens or destroys the bacterial cell wall, causing lysis or death. So for penicillin, they end in cillin like amoxicillin or ampicillin, and even piperacillin and tazobactam, which is kind of the outlier there. Now, cephalosporins start with ceph, like cephalexin, brand name Keflex. and cefazolin, and even ceftriaxone, the brand name Rocephin. Now, both are considered pregnancy safe and breastfeeding safe, but there are some specific differences. Now,
Watching. For our full video and new quiz bank, click right up here to access your free trial. And please consider subscribing to our YouTube channel. Last but not least, a big thanks to our team of experts helping us make these great videos. All right, guys, see you next time.